Your next CT could be increasing your cancer risk. Here's what a new study shows. A new study from JAMA Internal Medicine shows that CT scans modeling could possibly lead to an increased rise in cancers in the United States. The researchers warn that this is primarily caused by the overuse of CT scans, which could lead up to 100,000 cancers in the adult population and 10,000 in the children. They suggest that the CT scans, the total amount, could cause up to 5% of all cancers in the United States. This would put it roughly around the same amount as what is expected currently from alcohol use. Since 2009, there has been an increase of 30% in CT uses inside of the United States. Now, currently in 2023, there was a total of almost 100 million CT scans. That's about one for every 3 people. Now, CT scans can cause an increase in cancer due to their ionizing radiation, which can cause damage to your DNA and other genetic material, causing cancers to arise. Now, often we don't really take this into consideration because CT scans are used for emergency purposes, let's say an emergency fracture or a diagnosis, and so often the risks of these often don't outweigh the benefits. However, the researchers are starting to suggest that CT scans might be overused and that they should only be used when they are clinically necessary in order to get the correct diagnosis for the patients and ultimately help them. Now, the researchers do suggest that this is just based off of a model, meaning that this isn't a direct answer, but they do kind of show that these are signals that we need to keep an eye out, that we shouldn't be overusing CT scans, but using them when necessary. And ultimately, it still seems like individuals in the United States are still going to get cancer. So when we need to use CT scans for necessary reasons, the risk of this still doesn't outweigh the possible benefits of getting a CT scan. Despite this, clinicians as well as other physicians should be considerate of using CT scans more reasonably.